Welcome to Matski Dental and Dermatology. I'm Dr. Tariq Ansari. I'm the medical director and the orthodontist. Today we're going to discuss something about braces. What are braces? How do they work? What are the different types of braces available at Matski Dental and Dermatology? And how you can contribute to the success of your own treatment. So let's talk about braces. Now, braces are nothing but fixed appliances that are placed on top of your teeth to make sure that the teeth move in the desired position. Now, it's not just the teeth that we're moving, we're also moving your gums as well as the surrounding bone. How do braces work? Now, braces work by applying light continuous force on your teeth, which later gets transmitted to your bones in your gum. Now, this is done through the periodontal ligament. Light continuous forces help to move the teeth in the correct position. Now, let's talk about your orthodontic treatment. Now, orthodontic treatment is basically divided into three phases. You have your diagnostic phase, you have your active orthodontic phase, and then you have your retention phase. The diagnostic phase is a very critical phase in orthodontic treatment. This is when your orthodontist will check the conditions of your oral cavity. Then they will decide what treatment to do depending on what they see in the x-rays as well as in the models. The type of treatment that you require, the type of braces that you require, and whether you require extractions or not. This is all decided in the diagnostic phase of treatment. Once a diagnosis is made, the orthodontist will discuss with you your treatment plan, and then when a common consensus is reached, we can go ahead and start the orthodontic treatment. Now let's talk about the active orthodontic treatment. The active orthodontic treatment can incorporate habit-breaking appliances. It can incorporate devices to correct your jaw positions, as well as the actual fixed braces. Now, placing braces in your oral cavity is not such a problematic thing or a painful thing. In fact, it's very comfortable and you'll be surprised how quickly it can be achieved. Once the braces are placed in your mouth, the orthodontist will call you for a periodic checkup almost every month to adjust the wires and to adjust the braces as well. Now, your responsibility during this time is to make sure that you maintain your oral hygiene, make sure that you do not break any braces, make sure that you do not eat anything hard or sticky. Once the entire treatment of orthodontics is over, which will roughly take about a year and a half or so. Once your treatment is done and your teeth have moved into the correct position, then you reach the final day where your braces will be removed. Now, a lot of people have the misconception where they think that once the orthodontist removes my braces, my orthodontic treatment is done. This is not the case. The third phase of your treatment is the retention phase. In this phase, the orthodontist will deliver retainers to you. The retainer can either be a fixed retainer or a removable retainer. The fixed retainer is placed on the inner surface of your teeth. Now, once the fixed retainer is placed, you have to be careful not to eat anything too hard so that the retainer breaks. And God forbid, if the retainer does break, you have to make sure that you visit your orthodontist so he can repair the retainer. Do not leave a broken retainer in your mouth because this will be uncomfortable for you, as well as it allows the teeth to move back into their original position, which we don't want. This is called a relapse. Now, a removable retainer that is delivered to you either can be a complete transparent retainer or it can be a retainer with a wire incorporated into it. Now, the removable retainer is completely dependent on you because you have to make sure that you wear the removable retainer regularly. The removable retainer is worn continuously at first, then over a period of time, you can taper down the wearing time until finally you don't need to wear it anymore. The type of retainer, as I said before, is determined on the kind of problem that you have to begin with. Sometimes, some patients require a permanent retainer, whereas some patients only require a temporary retainer. This is the retention phase. At Matski Dental and Dermatology, we have different types of braces. We have the conventional metal braces, we have the diamond braces for metallic braces, and we also have ceramic braces. Ceramic braces are clear braces that are not very visible to someone else. Now, in case you want to get your teeth straightened up, but you do not want to go for braces, then a good substitute for that are clear aligners. Clear aligners are clear, removable, transparent appliances that you can wear in your mouth periodically and make sure that your teeth get aligned. Now, not all cases are suitable for aligners, but your orthodontist will know whether your particular situation is good for clear aligner treatment. Now, these are the different types of braces that we have available here. Apart from this, in orthodontics, we also incorporate breaking habits through habit breaking appliances, and we also have jaw correction devices to make sure that when early detection and treatment of your jaw problems can actually prevent complicated surgeries in the future. This is orthodontic treatment in a nutshell. So when is the right time to go for braces? Certain conditions of the oral cavity require immediate attention, and certain conditions can be waited for some time. Now, what type of problem you particularly have, it's best to consult an orthodontist. So the earlier you see the problem, the earlier it can be fixed. There are certain types of jaw-related problems that when you detect these problems and you treat them earlier, it actually prevents complicated surgeries in the future. So the ideal orthodontic treatment age can vary between 12 to 18. This is the ideal age. But adults, don't be worried, because with the advent of new technologies, you can actually have your orthodontic treatment done well over the age of 50. It all depends on how well you've maintained your gums and your oral hygiene as well. Orthodontics as a field has gone through a massive amount of evolution for the past 100 years or so. With the advent of new technologies, with the advent of new metallurgical sciences and the study of metals, and also by understanding the human body, the physiology of the human body and how the bone works, we're able to incorporate all these principles into the latest orthodontic treatment systems. Now, how does this help you? It helps you because it makes your treatment more comfortable, more quicker, and more accurate. So start your journey of a beautiful smile with Matski Dental and Dermatology. Hope to see you soon.